And for me, I'm just really excited to see where we're going to go with, where we are now with QB Mobile and what the next step is going to be after QB Mobile. Who knows, like what Qbtech is going to come up with next. And that's why it's so cool to be a part of this company, because we don't mind pushing the envelope. We are truly trying to see how we can better the provider, but more importantly, how we can help those who are in need in trying to find treatment and help with ADHD.
I'd love to get some examples from you both around how have you seen research really drive innovation?
Personally, I've seen it where previously, before I came to Qbtech, I worked in neuroimaging research in a neuropsychology department with focus on neuroimaging. And one of the things that we focused on was looking at changes in white matter structures following pediatric traumatic brain injury. And it was really interesting to learn the behavior of how certain white matter structures in the brain would change post-injury, but not just immediately post-injury, but up to 2 years post-injury. What was the restructuring of those neurons? And based on that, actually, we developed cognitive behavioral therapy programs to help certain functions that patients lost or were disrupted, and help develop programs tailored to that to help them rebuild some of those lost skills and cognitive functions. So, had we not known through the research what is getting most disrupted, we wouldn't know how to focus our rehab program. So, yeah.
For me, before I came on with Qbtech, I used to be in pharmaceuticals, and I can distinctly remember we had this one parent, and they had a child, and she was 100% convinced it wasn't ADHD. It was the fact that, this child just would not listen to her. This child was disruptive on purpose. And so you could almost see the conflict where they were coming in, and, before they entered the study, it was just fighting back and forth. And so with this one particular study, we would have them come in on a Saturday. And so half the group would take the medication and half wouldn't. And we allowed this parent to kind of like sit in for a while and just watch. And so once the individual took the medication, they started doing what they were supposed to do as far as like taking a test, let's say, or playing a game. You could actually see the mother start to cry because she was so upset with her own self for not thinking that there was something else possible, instead of it just being, he's hard-headed. He's just like his dad. He doesn't want to listen. He doesn't care. And so from that point on, you could just see a little difference in the dynamics from seeing it with our own eyes and seeing the change that could happen.
Looking at, the way that virtual care is delivered, and can we measure treatment response in a virtual setting? I think this is something that we wouldn't have imagined even 5 years ago. And, so to see that publication and to be able to showcase that, because clinicians want to know, can it work? How does it work? Why should I add this particular thing to my practice or to my network? And I think being able to show not only on a group level perspective, yes, here's where patients came in at a baseline, and here's where they got better at first treatment and then second treatment, and also the individual changes that each individual might respond differently depending on the domain and the level of impairment, has really proved, to your point, the patient, right, that individualized care, but then also to the clinic and the network to be able to say, this is why and how we are making these decisions in the way that we are, and this is why we're more standardized in the way that we approach ADHD. And I think that data has actually been incredible from an innovations perspective to also look at, remote, therapeutic monitoring and what that will mean for the future, and being able to look at more. Can we measure patients more closely? So that's one of the things that I'm excited about when we think about, data and research and clinical outcomes.
Yeah, I got a very similar response when we went to the conference in November presenting the Qbtech treatment monitoring data. And a lot of the comments that I got from clinicians was, this is amazing. If we can integrate this, right, it creates a sense of balance for treatment monitoring for the patient, and being able to better inform the clinician to get more confidence in, yeah, we're on the right track. Let's keep going with this medication. Oh, maybe not. Maybe we need to pull back, try something else, right? And then to be able to provide that virtually, right, in this day and age of virtual healthcare and telemedicine, I think that is the most exciting part. Is, like you said, it's being able to change that construct of you must come in every 2 weeks and see the patient and do this and see how they're doing physically, in person. We can still pretty accurately assess how they're doing and not create an extra burden for the patient, of taking time off, having to come to a clinic that may or may not be nearby. And it changes a lot for both the clinician and patients.
Well, thank you guys so much. This has been a very robust discussion, and I think we probably need at least a part 2, if not a part 3.